Good morning and welcome. Cross Country is pleased to introduce today for National Nurses Week Dr. Rosa Maria Gonzalez-Guarda. Rosa Maria Gonzalez-Guarda is an assistant professor at the University of Miami School of Nursing and Health Studies. In the past, she has worked on community health nursing projects, public health programs, and research targeting African Americans, Hispanic Americans, and other vulnerable populations in Europe, Latin America, and the Caribbean. Her current research focuses on the intersection of substance abuse, intimate partner violence, and risky sexual behaviors among Hispanics and the development of culturally tailored interventions to address these. She is the principal investigator of a community-based participatory research study aiming to develop a domestic violence prevention program for Hispanics in Miami-Dade County. She also served recently as a committee member for the Robert Wood Johnson Foundation Initiative on the Future of Nursing at the Institute of Medicine. Dr. Gonzalez-Guarda graduated from Georgetown University with a Bachelor in Science of Nursing, from Johns Hopkins University with a Master in Nursing and Public Health, and from the University of Miami with an interdepartmental doctorate in nursing, epidemiology, and psychology. And please join me in welcoming Dr. Gonzalez to the podium. Thank you.
Thank you. Thank you. Thank you, everyone. It really is an honor to be here with you all to celebrate Nurses Week. I think we have a lot to celebrate this year. We have a very promising and exciting future ahead of us, and I hope to spend the next hour or so talking a little bit about those opportunities that we have in the future. In doing that and talking about the future of nursing, I'm going to talk a little bit about our current situation as we speak. What is the current value of nursing as we see it now? And what are some of the obstacles that our profession faces that limits our ability of really utilizing our value to improve health outcomes for the nation? Then I'm going to move on to talking about the future of nursing. Specifically, I'm going to speak about the Institute of Medicine Committee's recommendations on the future of nursing. I had the wonderful opportunity to be able to participate on that committee at the Institute of Medicine. And so I'm going to share with you some of our key recommendations and also share with you some of the exemplars that we saw when we were putting together the recommendations. During one of the activities that we were conducting as part of our study process, we invited various experts and various nurses to testify and to share what their ideas about the future of nursing was and from their perspective. And there was one nurse leader who's the vice president of Kaiser Permanente, Marilyn Chow, who said something that really impressed me. And I think it's something that impressed the committee, and I think that theme is seen throughout the report. She said that the future of nursing is here. It's just not everywhere. And what she was referring to is that there's currently a lot of innovation. There's a lot of great practices occurring on the ground level. However, because of a series of reasons, a series of barriers that we face, lack of dissemination of these practices, we're not currently at our future, meaning that we're currently not using nurses to the full potential. So I'm going to share some of those exemplars that we see. Some of them are very innovative, and some of them are not so innovative. They've been, things that we've been doing for many, many centuries. It's just actually not, widespread and disseminated. So I'm going to share a little bit of that with you. So by now we should all know that nurses are the largest proportion of the healthcare professionals. We're 3 million nurses, which makes 80% of the total number of healthcare providers. Within that, a small portion of these nurses are advanced practice nurses, which is 200,000 advanced practice nurses. I'm highlighting that number so that I can remember to identify the number of primary care physicians that we currently have, which is 800,000. So advanced practice nurses have the capacity to fill that potential need that we're facing. And another thing that's important regarding nurses is that nurses are found everywhere. Nurses are primarily in hospitals, the largest percentage are in hospitals, but nurses can be found in schools, they can be found in retail clinics, they can be found in occupational health settings. So nurses are large in numbers and they're disseminated everywhere, and that's a very powerful thing. Here we have a graph depicting where nurses practice, and as you can see, the vast majority of nurses practice in hospital settings. And this is actually an increase. We've been seeing a steady increase in the proportion of nurses that actually work in hospital settings. And you can see that the remainder are divided among a series of different settings, including community and outpatient settings. I always like to go back to the definition of nursing. I think that for us to talk about what the value of nursing is and what our potential is in terms of the future, it's important for us to be reminded of who we say we are. And that reminder will also allow us to learn how to be able to communicate our value more effectively with others. So here we have the nursing definition from the ANA, from our nursing social policy statement, which is a reiteration of the statement or the definition that came out in 2003. And again, we saw the same definition in 2010. And here we see that nursing is defined as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. I think there's various important, this is a very heavy definition, and I think there's various components that are worth highlighting here. I think one of them is the fact that nurses are dedicated to the health and well-being of individuals, families, and community along a wide range of spectrums. We cover all levels of prevention. Primary prevention before individuals, families, or communities are sick. Secondary prevention when identifying individuals that are sick and getting them into treatment. And then tertiary prevention in terms of working with individuals that are sick and addressing their suffering and minimizing that suffering. Another important component here is that the purview of nurses is the human response to illness or wellness. And in that, we're looking at not only the quantitative measures of their response, so not only their vital signs, for example, blood values, but also their qualitative response. You know, how they feel with that illness, the burden that that brings on them as individuals and their ability to live a normal life, the burden that that brings to the family, to the community, etc., the pain that that causes. I think that's an important thing to highlight and is part of the value of nursing. And then finally, the fact that our patients are oftentimes individuals, but also their families and the communities that they come from. So we're not, solely focused on just the individual health needs and wellness, but also that of their families and general communities. So on top of the numbers and the fact that we're everywhere, there's important key things for us to identify in terms of what is the value of nursing. One of these key components is the close proximity that nurses have to their patients. So they're individuals that the healthcare professionals that tend to spend most time with their patients, and consequently they have a really strong grasp of what their needs are and what effects illness and wellness have on their daily life. Another thing that's important to highlight is that the nursing profession and the nursing discipline has really a strong understanding of the scientific basis of caring. We have philosophies, theories, models that define and help guide what caring is. And we've developed a whole series of evidence-based practices based on those theories, philosophies, and models. And we've tested those and have shown to add a great deal of value to society in terms of providing safe, high-quality healthcare to individuals and populations and improving health outcomes for the nation. And also, on top of those, hard health outcomes, we've also shown to improve patient satisfaction and things that are more, that sometimes are not received as much, attention to. And consequently, we have the great responsibility of being the most trusted health professionals and the most trusted professionals in general. Here we have a graph depicting the results of the 2009 Gallup poll, where you see that nurses on the very top of this list in regards to very high honesty, having very high honesty and ethical standards. And you see that on this list, it's not just healthcare professionals, we have other types of professionals. So this gives us a great deal of responsibility in terms of continuing to have this status and to responding to the needs and the desire of society.